Hip arthritis is a common problem that lots of people experience as they grow older. And when people have problems with their hip, they're looking for options in order to sustain an active lifestyle. And so I get a lot of questions about what is best for me, either a hip replacement or a hip resurfacing. And a lot of people don't know the difference between the two types of procedures. A hip replacement is basically a procedure where the ball of the hip is removed and both the socket and the ball are then replaced with a stem that goes down inside the thigh bone. The difference with the resurfacing is that instead of removing the ball, a cap is placed over the ball and the socket is still replaced. There are several downsides to a resurfacing. And one is the resurfacing typically only lasts about 10 years. Second, in order to resurface a hip, the hip has to be dislocated out of the socket, which means they typically have to cut every muscle away from the proximal femur in order to resurface that hip. So a lot of surgeons will portray a hip resurfacing as less invasive, but it's actually pretty maximally invasive with regard to the amount of muscle damage that the procedure causes. And that muscle damage can cause you later problems down the road when you do have to have a hip replacement. The other problem with hip resurfacings is that they are metal on metal components. And so a lot of the problems that total hip replacements have with metal on metal components, the same things apply to hip resurfacings. And there's problem with metal ions being generated that get into your bloodstream and can cause other problems. Thus, a hip resurfacing is not always the best option. I typically reserve that procedure for patients who are in their 30s, who need some time before they have a hip replacement. As mentioned, the hip resurfacing only lasts about 10 years. So that buys that patient some time. Once a patient gets into their 40s, 50s, and later, they're better off with a hip replacement. So the difference with a hip replacement, specifically when done by an anterior approach, which means we come from the front part of the hip and we don't have to cut the muscle, is a much faster recovery for patients. I've had lots of patients who've had a resurfacing done on one hip, have a replacement done on their other by anterior approach, and they all say what a big difference the anterior replacement was compared to their resurfacing. So not cutting the muscle with an anterior approach hip replacement makes a big difference in recovery. Plus, the components that we use for a hip replacement can last over 30 years. So you get much more longevity to the hip replacement, a lot faster recovery and easier recovery with an anterior approach versus a hip resurfacing. When considering hip replacement surgery, anterior approach should definitely be the route that you should consider when you're having your hip replaced. There are numerous advantages to anterior hip replacement surgery. One, it's a smaller incision size. Two, usually a shorter hospital stay. There's less blood loss, less pain, faster recovery, less chance for dislocation of the hip afterwards, and more equal restoration of leg lengths. So there's numerous advantages that you can have from anterior hip replacement compared to the traditional routes. If you're considering surgery for your hip and you're choosing between a hip resurfacing and a hip replacement, there are several things you should consider. One is your age. If you're younger, in your 30s, a hip resurfacing may be a reasonable option for you. But if you're upper 40s, 50s, and 60s and above, a hip replacement with an anterior approach is probably your best option. Anterior hip replacement also allows a patient to have their surgery done outpatient in our convenient outpatient surgery center, which provides a cost-effective option for patients compared to a typical higher-priced hospital surgical stay. Anterior hip replacement is another example of how the doctors at Palmetto Bone and Joint provide our patients with the most cutting-edge care to get them back to their active lifestyle quicker.